Hello everyone, welcome to CHO Medical Classes. Today's topic chronic bronchitis. Let's begin. Question number 1. Chronic bronchitis is classified as which type of lung disease? The right answer is option B, obstructive lung disease. Question number 2. What is the main characteristic feature of chronic bronchitis? The right answer is option B. Question number 3. Which of the following is the most common cause of chronic bronchitis? The right answer is option C, smoking. Question number 4. In chronic bronchitis, which of the following changes occur in the airways? The right answer is option D, all of the above. Question number 5. Which type of cell are responsible for excessive mucus production in chronic bronchitis? Right answer is option B, goblet cell. Question number 6. What is the hallmark symptom of chronic bronchitis? Right answer is option C, productive cough. Question number 7. Chronic bronchitis is a part of which disease spectrum? The right answer is option A, COPD, chronic obstructive pulmonary disease. Question number 8. Which diagnostic test is most commonly used to evaluate the severity of chronic bronchitis? The right answer is option B, spirometry. Question number 9. What is the typical finding on a chest X-ray of a patient with chronic bronchitis? Right answer is option C, increased bronchoscopal markings. Question number 10. Which of the following is a primary complication of untreated chronic bronchitis? The right answer is option B, pulmonary hypertension. Next question. Question number 11. Which medication is commonly used as a first-line treatment of symptom relief in chronic bronchitis? The right answer is option B, beta-2 agonists. Question number 12. Which of the following is a key non-pharmacological intervention for chronic bronchitis management? The right answer is option A, smoking cessation. Question number 13. Which vaccine is recommended to prevent respiratory infections in chronic bronchitis patient? The right answer is option A, influenza vaccine. Question number 14. A part which chronic bronchitis is referred to a pulmonary rehabilitation program, which component is most beneficial? Right answer is option D, exercise training. Question number 15. What is the purpose of using mucolytic agent in chronic bronchitis patient? The right answer is option B, thin the mucus for easier expectoration. Question number 16. Which of the following ABC findings is commonly seen in severe chronic bronchitis? Right answer is option B, respiratory acidosis. Question number 17. Which characteristic sign is often seen in patients with chronic bronchitis? The right answer is option C, cyanosis, blue water. Question number 18. What is the most common bacteria responsible for exacerbation in chronic bronchitis? The right answer is option D, Haemophilus influenza. Question number 19. What is the purpose of oxygen therapy in chronic bronchitis patient with severe hypoxia? Right answer is option C, correct hypoxemia. Question number 20. What is the most effective long-term studies to prevent the progression Sign of chronic bronchitis. The right answer is option B, smoking cessation. Question number 21. Which of the following is a hallmark pathological feature of chronic bronchitis? The right answer is option C, mucus gland hypertrophy and hyperplasia. Question number 22. Which diagnostic criteria are used to differentiate chronic bronchitis from other respiratory disease? The right answer is option B, chronic productive cough for 3 months in 2 consecutive years. Question number 23. Which lung sound is most commonly heard in patients with chronic bronchitis? The right answer is option C, Ronsi. Question number 24. Which arterial blood gas finding is expected in a patient with severe chronic bronchitis? The right answer is option 7.35 PaCO2 55 mf of Hg PaO2 60 mf of Hg. Option A is correct answer. Question number 25. Which of the following lifestyle modifications is most beneficial for a patient with chronic bronchitis? Right answer is option B, quit smoking. Question number 26. Which pharmacology class of drug is most effective for bronchodilation in chronic bronchitis? Right answer option A, beta 2 adrenergic. Question number 27. What is the most common complication of chronic bronchitis? Right answer is option B, core pulmonary right-sided heart failure. Question number 28. Which test is used to monitor oxygen saturation levels in patients with chronic bronchitis? The right answer is option B, pulse oximetry. Question number 29. What is the role of corticosteroids in the management of chronic bronchitis? The right answer is option B, to reduce airway inflammation. Question number 30. Which nutritional advice is appropriate for a patient with chronic bronchitis? The right answer is option A, high calorie, high protein diet. Question number 31. Lifestyle recommendation is most appropriate to prevent exacerbations in chronic bronchitis? The right answer is option A, use humidifiers during dry weather. Question number 32. Which statement best describes blue bloater in chronic bronchitis? The right answer is option describes patient with cyanosis and peripheral edema. Option B is correct answer. Question number 33. Which breathing technique can help a patient with chronic bronchitis during an episode of breathlessness? Right answer option A, purposeful breathing. Question number 34. Which blood test result indicate chronic respiratory acidosis in a chronic bronchitis patient? Right answer is option increased PaCO2 and decreased pH. Option A is correct answer. Next question. What the best position to relieve dyspnea in a patient with chronic bronchitis? The right answer is option C, Fowler position. Next question. Which condition is often associated with chronic bronchitis? The right answer is option A, emphysema. Question number 37. Which parameter is assessed using spirometry in chronic bronchitis? The right answer is option D, all of the above. Question number 38. Which medication is contraindicated in chronic bronchitis patient with COPD? Right answer is option A, beta blockers. Question number 39. Which gas is commonly retained in chronic bronchitis leading to hypercapnia? The right answer is option C, carbon dioxide. Question number 14. Which intervention is most effective in managing chronic bronchitis in the long term? The right answer is option B, long-term oxygen therapy. Thank you for this watching video and don't forget like, share and subscribe. Jai Hind, Jai Bharat, Vande Mataram.